Welcome back to the Move Better channel. How you guys doing? This is John Penacerrada, and we got Dr. Joe in the house. And today, we're actually just going to have a conversation. There's been a lot more cases that we're running into in the exercise field, wellness field, sports medicine field, in which we're hearing more and more people looking or being prescribed, I guess you could say, the option to get knee replacements or even hip replacements. And through the last several years, there's definitely been a lot more technology involved in research. But I just want to pose the question: why is it being prescribed more nowadays? Number one, and then number two, is it necessary?
So one of the big questions that I get is hey, do I need to go through surgery when my patients are in pain? Whether it's cartilaginous or bone on bone is what they would say.
Yes, yeah.
And I almost feel like the question or the fate is inevitable nowadays. And, do I prescribe it? Yeah, I prescribe it if that's what it is. And it is a case by case. It depends on the dedication of the patient. It depends on how willing is the patient to work to not go under the knife or get the replacements, right? And it's a case by case scenario. And for one, does it work? Absolutely. I mean, I think there are some people that feel way better when they get it. But then again, I also have a group of patients that have gotten it and are completely in pain and haven't gotten the help that they need when the research shows that they're supposed to be out of pain.
Yeah.
So they're not prescribed PT. They're not prescribed any type of treatment post-surgery. I'm looking at it like, why not?
Yeah.
Right? And that's where I start to have my concerns start to raise. And I'm going strictly off of an experience rather than all the research that's out there, because there are so much there's a lot of research that supports surgery. There's also research that supports conservative treatment, which is going to be more of PT and exercises than anything else. But then again, it comes down to what's the bias of that research study, right?
Sure.
And we've got to take into context every single detail. How was the research conducted, and
age ranges,
who did it?
Yeah, sure.
Was it a blind study? There's so many different avenues to it, and I'm not an expert at all of that stuff. I just take it from the books that I've read and the research that I've done on my own versus all of the research studies that are out there. Okay,
Yeah.
So it's more of a based off of an experience thing.
Yeah.
Now, going back to the question, is it needed? Sometimes it is. It actually is. And again, it comes down to the patient on what they're looking for and what they're trying to do. But I'm reading the book Outlive by Dr. Peter Attia, and he talks about, in the very beginning of the book, he talks about medicine versus longevity and when we pose the help. Now, there's been a lot of advances in medicine and medication, and there's been a lot of things that have been done in medicine that allows for immediate help, right? But one of the things that he says in the book is he talks about how we are lacking in medicine when it comes to long-term diseases, right? And such as heart disease and diabetes, Alzheimer's. We talk about all of those. Those are chronic issues that have a long-term effect. And yes, we may be diagnosed with it, but it's something for a long-term investment that we need to do now. Same thing with surgery. The way I look at it now is surgery and certain joint pain. If you're not up to ensuring that you have healthy joints, healthy function, or healthy movement, you're setting yourself up for degenerative diseases, breakdown, which can
lead you to that potential knee replacement, hip replacement.
Exactly.
Absolutely.
And again, one of the main things that he talks about in his book is he talks about exercise.
Yeah.
He talks about movement and how important that all is to ensuring that we don't deal with other diseases, pathological diseases like heart disease, heart attacks, and all of the above. Now we're talking about organs versus joints, but they all come together
yeah.
with a understanding that we need to ensure that we start worrying about our health in all avenues versus the acute situations.
Right. And you actually, good point, because if you look at, and I'm not an expert on this as far as like diagnosis or anything like that, but if you look at research or any kind of diseases that we are dealt with, there's one common actual prescription that they will say. And what is it? You need to exercise.
You need to exercise.
You look at all the books, look at all the research. One of the things they'll always say there is exercise. So that's something that we can control,
Yeah.
right? As individuals, is to go ahead and exercise and whatnot, and you do it now just so that you can continue to stay healthy, and then just see where that pathway takes you. And if it does lead you to a point where, hey, you'll probably feel better and relieve all this pain and issues. If you get into surgery, then that's the route that you need to go. But from my perspective, and just being in the wellness fitness field for 25 plus years, exercise has always been a component that we all need to take into consideration as far as health is concerned.
Exactly. And one of our colleagues talked about it, and he says it's quality movement.
Yes.
We want to make sure that exercise is a general a general idea, but
when they say movement is medicine, he said quality
movement is medicine.
Shout out to Rich Thurman.
Rich Thurman on that. That was pretty cool. And I've heard that term before, but it is quality movement that we are looking for as practitioners to ensure that people can exercise pain-free, right? We want to make sure that people can get quality movement that can work on pain-free movement,
Yes,
right?
sir.
So that way you can work on longevity and keep moving forever. Because what are the most people prescribed once they get injured? Don't move.
Don't move.
That's it. Like I had a patient in here the other day who sprained her ankle, and then all of a sudden her medical doctor put her in a boot. And when I said, I don't think you want to do that, my patient didn't want to listen to me, went to a physical therapist, and the physical therapist agreed with me, right? Because this is our expertise, right? Not all chiropractors are experts in movement, but in our expertise is, in sports medicine, we have physical therapists that even say the same things, right? You want more movement, and we want to be careful on how much we baby certain things. Now, that's not all the time, but we also got to take every single consideration for the type of ankle sprains or injuries that we deal with. So back to the whole surgical procedures, make sure that you guys work on the long-term, the long-term movement, right? Again, I had a kid in here the other day, 17 years old, and or a teenager, 17 years old, and I was already noticing that they were having restrictions, and I'm like, man, you're 17 years old, you shouldn't be having these type of pains, you should be moving a lot. How much exercise do you get a day? She goes, oh, well, I kickbox.
Ooh.
And I go, great, awesome. How many times do you do that a week? Once a week.
Oh, sorry.
And I'm like, man, because we laugh at that because it's like, man, people and our patients, our world, we are falling into a trap of less and less movement, especially with the way AI is, school, technology, everything, and it's getting worse. And we want to try to get people to move more. And again, there are also research studies that tell people you just need to move for 20 minutes a day.
Sure.
I don't even think that prescription is accurate enough. I think people need to be moving a minimum of an hour a day, especially the type of world that we're getting into, to prevent these pathological diseases.
Right.
From the things that Peter Attia talks about with heart disease and Alzheimer's and early death. We're talking about how can we prescribe movement so that we can decrease the risk of you having to get a brand new knee or a metal hip. When is it prescribed? Really comes down to the person. When we have a bone on bone, when we have destruction, I do recommend it if it's really needed. But then again, it also comes down to the dedication of the patient. How much are you willing to put into it on a daily basis rather than a...
Dedication, absolutely, because guess what? After that surgery or the knee replacement, what do you have to do right after?
You got to freaking move.
Exercise therapy, man,
Exactly.
right away. And so if you're not already conditioned to do those things, you're gonna eventually have to do it anyway.
Exactly.
So might as well start. You know, they call it prehab now, right? Prehab.
Prehab,
Which is basically you're trying to get the body ready for surgery. Sometimes you get that prehab so well that, hey, guess what? Your knee's moving a lot better.
Yeah, exactly.
You know,
Shout out to the prehab guys.
Yes.
If you guys haven't seen them, check out some of their stuff. They got some good stuff on there.
To basically wrap this conversation up, you know, continue to exercise, move, talk to different specialists from not just surgeons, but physical therapists, sports chiros. Get a whole grasp of, do you actually need it, and what have you done where you can control the outcomes by doing exercise, moving, and see how that takes you before you do go under the knife.
Yeah, and there are options out there, you guys.
Yeah.
So make sure you guys do shop around and check with your local professionals on how they can help.
Yes. So like, subscribe, and share. And till next time, this is the Move Better channel. We'll holla at you.
See you guys.